Medication regimen is critical. This is where a lot of dentists fail. 8 medications for sinus lifting, assuming no penicillin allergy. I prescribe Augmentin 875 twice a day, 10 days. Start 2 days before, minimize infection in the sinus, minimize anything that can potentially infect the sinus. Patient is already pre-medicated on the Augmentin before. Make sure the patient is taking probiotics because it kind of wrecks the stomach. For all sinus lift cases, whether it's crestal or lateral, I use some form of sedation. Unless the patient is like, I don't need it or don't want it, then it's rare. I prescribe Ativan, which is lorazepam 2 milligrams, 1 tablet 1 hour before. And I like to augment this with nitrous oxide. It's optional. I like to use it, at 50, 60%, which is kind of getting close to the maximum, which is 70%. We're getting the patient comfortable enough not to care about the procedure, not to care about the tapping. The reason I do this, it's number one for the patient. Second, it's for me. I need my time. I don't like to rush things. I like to make sure that we do it very carefully and that I have good visualization. I don't like to, have another patient booked right after where I have to rush. What if we have a complication? So I take my time. Sedation is important. Following the procedure, I keep my patients on 600 milligrams of ibuprofen every 6 hours for at least 2 to 3 days. Around the clock, be ahead of the pain. There's a lot of inflammation. There's a lot of swelling that happens mostly from a lateral sinus lift. And I have them combine with the ibuprofen, they combine it with acetaminophen, 1,000 milligrams, which is basically 2 extra strength Tylenol every 6 hours. So they take 3 Advil, 2 Tylenol every 6 hours, no matter what. Now, at nighttime, they can take away 1 Tylenol or take all the Tylenol away, all the acetaminophen away, and replace it with Percocet. So I'd like them to have some form of narcotic. Be careful what you're prescribing, who you're prescribing for. Here in the United States, very strict rules. You don't want to give a patient more than 3 days of supplies of narcotic medications. Follow the rules. Now, even more strict. We are no longer giving prescriptions. Everything is done through email and e-scripts, through specific portals, actually much better, much faster, and much safer, and helps to prevent abuse and confusion. For every sinus lift, I prescribe over-the-counter or recommend over-the-counter Sudafed, and they just take it preventatively for about 2 to 3 days. And if they feel very congested, they'll keep taking it for a whole week, but most patients don't need it more than 2 to 3 days. It'll minimize the bleeding from the nose. It'll minimize congestion or the feeling of congestion. And for some patients, I'm also prescribing a Medrol dose pack, which is a corticosteroid taken for about 6 days. Most of the pain comes from swelling. That's what's kind of dramatic, more in the face. And yeah, it's going to happen. Your patients are going to swell. They had surgery. They're going to swell. So make sure that you are prepared with those 8 medications. You don't have to use all of them. You want to look into what allergies they have, medical contraindications, what other medications they have. Be a real doctor. For most of my patients, they're getting up there. They're 50, 60, 70 years old. We get medical clearance. If they take medications, even somebody taking Celexa, I'm giving them a sedative. I'm going to get a medical clearance and inform their physician about what they're going to have. Okay, so take a screenshot and study those medications. Okay, so let's start lifting, guys.